Welcome, everybody, to the Mental Health Hour. We are back. Daddyhood does you good. The word is out that I became a father again. I'm a stepfather, but I'm a father now to my daughter, who was born April 21st, which was Thursday morning. So the night after our last episode, once midnight rolled over into Thursday, we were on our way to the hospital. So anywho, everybody knows that by now anyway, but I wanted to make a formal announcement myself because I haven't been on. I've been in the comments of some broadcasts and what have you, but I haven't streamed. So Gemma and I got to talking while I was still at the hospital. My wife had a C-section, so we were there for 3 days, 4 days, 3 nights while she recovered. But we were talking about what episode to do, and what better than sleep deprivation, because it really hits right now. We have done a episode on sleep debt, which is a bit different, and we'll get into all that. But first, let's say hi to everybody. Joseph Burkhart's coming in. Jay Opera, good to see you. Tracy, and Danny Bruno's here. And thank you all for the well wishes. Thank you for the support. And we'll see if she's awake later. I might bring her on towards the end of the show and give you a real introduction. Anybody that wants to catch it on the replay. But if she's down, she had a bit of a long day today with doctors and stuff, so she didn't really get a good nap without being interrupted. This is her first real one, so we'll leave her be. But I'll get her on here at one point. So, good evening, Hattie. Good to see you. Danny Penelope's doing really well. Her nickname, Jay, is just Penny for now. Sweet Pea, whatever comes to mind at the time. All kinds of, there's an endless list. But the official...
there's an endless list as they get older too, but we won't go there.
Is Penny. Penny girl. So,
what is going on?
Anyway, I appreciate everybody again for putting all the congratulations in, and thank you guys. She's doing, but back to her, she's doing real well. The only she was born 38 weeks, so 2 weeks premature, but she was fully cooked. She was done. She was 10 pounds 12 ounces, 22 inches long, and healthy as can be. Mom and baby are doing well. The only thing we had was a little bit of jaundice, which is very common in newborns. Her levels were a little elevated, and she's got a yellowish tint to the skin, but that will go away. We were at the doctor today, and her levels are dropping, and the yellowness is starting to fade away. But yeah, like I said, very common with newborns. So nothing to really be worried about. She didn't even require treatment, which is just going under those UV lights.
I have to sort this out. Hang on.
Anyway, Gemma, how has your week been?
Crazy busy.
Yeah.
Like really crazy busy. We've been at the hospital quite a bit as well. With Thomas, he had his last bone marrow extraction last week. We get his results. Like some of them are in, we will get them tomorrow. The rest of them we'll get probably next week. They're doing the tests to determine whether his bone marrow has survived the full-term chemo session of 3.5+ years, whether there's any damage to the bone marrow, and if there's any trace of the cancer left, because when they do the lumbar puncture, it goes into the spinal column, which goes into the bone marrow, which it goes into the brain, because with leukemia, blood cancer, you can't take all the blood out, so you have to treat it everywhere because your blood is all over your body. So that knocked him up a little bit because it's quite a hefty needle they have to use. So he's been in a little bit of pain with that. But other than that, not too bad. Just really, really busy. But it's going on. We should only have 5 more weeks left of chemo now, hopefully. We've still got the cirrhosis that we're dealing with, but that will hopefully go when the chemo goes. Fingers crossed.
Awesome. Yes, fingers crossed indeed.
Mhm.
We'll all be thinking about you and Thomas. More info in Gemma's Discord, I'm sure, or the Mental Health Hour.
Yeah, put them in
You
both.
can always reach out to either one of us about anything we talk about on the stream or whatever you want to talk about.
Mhm.
And we're both very open with whatever you need to talk about.
Yep.
So let's get into tonight's episode. We wanted to talk about sleep deprivation, and it is something that is very real. And you don't know, some people don't really realize what their sleep debt is. So, like I said earlier, we did an episode previously on sleep debt, and how that lack of sleep accumulates and over time just runs this debt on you, like a credit card bill or whatever.
Yeah.
You rack up this sleep debt that you can never really recover from. You can try as you might. It's just one of those things that just keeps snowballing. So there's always stuff to be done, and it's understandable. That's the way life is. And, we work, we play, and we sleep when we can. But sleep is a very integral part of all of our mental health. A good sleep schedule alone could do quite a difference for your own mental health. And that's all. I mean, just changing your sleep habits and sticking to a sleep routine, sleep schedule that can change your life overwhelmingly. But you got to stick to it. It's one of those things like journaling. You got to do it. If you're going to journal, you got to stick to it. But speaking of journaling, I'm sure we'll get into that later as well. That seems to come up with every one of our episodes.
I was going to say, I don't think there's been an episode where we haven't mentioned it for something.
Yeah, exactly. So, my week now, having Penelope in our lives here, has been quite sleep deprived. And that's the way it is. That's understandable. I'm kind of taking on the main role while my wife recovers. She's doing well. I mean, but there's still an incision that isn't quite fully healed yet, and it still needs some time to heal. She can't lift a lot. She's not supposed to bend over, crouch, all that stuff.
I remember.
I'm sure a lot of you are familiar with the rules and regulations of C-sections and healing from them, but I want to do everything I can to help her get better faster so that we can be the team again, the best team for Penelope. So I guess kind of, trying, I could maybe do this a little better, but this is my job. Like I've trained for this for 15 years. Like I run on no sleep all the time. 7 years downtown does that to you. However, not everybody is used to a schedule that or work environment that doesn't allow sleep sometimes. So it can be quite devastating to some. And this will be, I'm sure, devastating to me. It's just I'm still running on adrenaline, trying to get to that finish line. And then once I hit that finish line where my wife is healthy again and able to help, I'll crash and burn. But I'll recover quickly, whereas she needs time to heal. It's very important, obviously, because you risk infection, you risk opening the incision back up, all that good stuff, and then she's no good for Penelope. And not to mention our other 3 kids, my stepkids, Brody, Lillian, and Abigail. So we got a lot going on here, and Mom is down and out for now, but slowly getting better. She's up, moving around, doing well. Just there's still some restrictions. That's all. And Gemma, let's talk about your end. How's your sleep schedule, if there is one? Seems it might be getting better, or no?
Over the last couple of weeks or so, I think it's been horrendous, to be honest. But then I'd been going through some pretty grueling therapy of late. I mentioned it on a previous show we did, where some of the traumas that I have been through have caused me to have long-term memory loss for parts of my life. There are huge chunks of my life missing. And I've started doing a very different type of therapy now. It's like a form of tapping. I have to hold something in both hands and do things, and it is actually bringing back memories of things that I had absolutely no recollection of. I want to do it because I want to be able to be in charge of what comes up when, rather than being triggered by something that potentially was meaningless at the time, but then it triggers me and everything snowballs, and I remember stuff that potentially I wouldn't normally have, and then all that happens again. So I want to be able to control that, own that, and put it to bed, so to speak. No pun intended there. But in turn, it is giving me, I've started having nightmares again. And I had one a few nights ago that was like, if I have another one, then I'm going to have to go back to the doctors, because it was very, very, what's the word? Aggressive, should we say? It triggered a memory of being attacked, but it was actually me doing the attacking in my sleep.
Oh, wow.
So like I have a monitor for that, so I'm being monitored if it continues, because I don't always remember doing it. But it's something that I want to do to be able to heal fully now. I'm at the stage where I feel like I'm ready to heal, ready to remember the stuff, because I found that I was filling in the blanks, and it was like, is it even true what I'm thinking I'm remembering? Or is it something that my brain's put in there to fill in the blanks, which isn't true? So I want to be able to remember it, deal with it, act on it, and then put it to bed forever this time. So yeah, I wanna be able to own it and get rid of it,
So that actually sounds like a definitely a good topic for a show I've been thinking about trauma processing. We touched on, or we did an episode on the traumatic brain, which could launch us into a great discussion about how to process trauma, which it's a skilled art form. And I was highly impressed by the work these people do, that trauma clinicians do to help you process something like you're speaking of, and kind of what's the word? Shoot, kind of just like reorganize the whole brain into being able to accept it and stamp it and file it away in a way that it's not always in the now. So that being said, we will try and do an episode on that. I'm not sure when. We have a few episodes upcoming that are topics that we've discussed, and we're going to do another live Q&A. I think beginning of June or end of May, one of the 2 days. So, all right, back to the sleep.
Yeah.
Let's see how easy it is for me to derail on other things when I'm sleep deprived.
Yeah.
Not that we follow any kind of normal, plan here on the show. We just kind of let it flow. But I do like to try and keep it on topic. Sleep deprivation. It hits all of us hard. And we can start, or get into it a little bit more with some of our famous slides that we go scouring the Google pages for. And of course, all these slides and information and links to the websites of these slides will be posted in our Discord, which if Gemma hasn't put it in the chat, I'm sure Hattie will. We need to probably make a banner for that. I've got the bio link on there, but not the Discord. It is on our bio link, though. I will put that up there. So come on in, join us in the Mental Health Hour Discord, and all these slides that we're about to go over will be in there, and their credits to learn more information. So Gemma, if you'd like to take it away, educate us a little bit here on sleep.
Yeah. Are you bringing the slides up, you say?
Yeah, which one? I don't know. You can hit them.
Okay. All right. Okay. So we will. I can just about control these ones without totally derailing the broadcast and pressing the wrong button. I think.
We'll see.
We'll see. The night is young. Okay. So this one here. In fact, let me start with the other one first, if that's the one I think it is. Yeah. So I added this one in because this is very relevant right now for Tim. So we have the recommended sleep. How much does your body need and how much does your baby need? So, okay, so newborn, daytime hours, they say 8.5 hours through the day, 8.5 hours through the night, and a total sleep time of 17 hours a day. I swear I'm a newborn baby sometimes. That's just how much my body wants. 1 month. So as they get older, it starts to get more through the night and less through the day until it completely omits the daytime. So 8 through the day and then 9, again, 17 hours. It gets less through to 6 in the day, 10 in the night, right down to the 18 months old, where it's around about 2.5 hours through the day and 11 hours at night, 13.5 hours in total. And then we have the one that's from infants, 4 to 11 months old, 12 to 15 hours. Toddlers of 1 to 2 years is 11 to 14 hours. Preschoolers, 3 to 5 years old is 10 to 13 hours. So school-age children, 6 to 13, 9 to 11 hours. Now, I know for certain that Thomas is definitely not getting that right now. Like, I swear he's still awake. So he's still with a guest. Teenagers, 14 to 17-year-old, 8 to 10 hours. Young adults, 7 to 9 hours. Adults, 26 to 64, 7 to 9 hours. And then seniors, 65 and older, 7 to 8 hours. I don't know why they just didn't put adults because it's the same. But anyway. So as we get older, we apparently need less. My body doesn't seem to agree with that right now. I just feel like I should be a cat and just sleep all day. But anyway, such is life.
Such
Then
is
we
life. That's I mean,
such is life.
that's what we started the show with, you know, in the initial going on about sleep deprivation is just life happens, man. It's just
Yeah.
that's all a part of it. Everybody goes through it, you know, like
Mhm.
nobody is averaging probably what they should be as far as
Yeah,
the
yeah.
sleep numbers go. I know
And
I hit 7 to 9 hours
mhm,
occasionally, but not every single night. Um,
mhm.
or every single
Yeah,
day, which I should say that every day, because it does not matter if you sleep at night, or if you sleep during the day, as long as you're getting your required sleep. Like some people work the overnights, the graveyard shifts, you
mhm.
know the the all nighters,
Oh,
and they
yeah.
sleep during the day. Some
Mhm.
people sleep from like they get off at 2 in the morning, come home, sleep from 3 to 11 or whatever. As long as you're hitting that goal, then
Yeah,
sleep whenever. That's the most important part. It does not
yeah,
matter. So go
and
ahead, Gemma.
again, yeah, as long as you're getting enough for you, like, and you're not unwell with it. Everybody's different. I joke sometimes and say that I'm not getting the right amount of sleep. I'm just on the wrong time zone. That's the thing. But anyway, um, so we have here some tips for preventing sleep deprivation. So, as Tim mentioned earlier, a consistent schedule. So, keep a consistent bedtime and wake up time to develop a routine, even on the weekend. Now, I know I am terrible for thinking, oh, it's the weekend. I'm just going to lay until whenever. And I'm terrible for that. But it can get you where, like, have you ever done it where you've had more sleep and you felt even more tired for it? Because they say that there is a right amount of sleep for
Sure is.
your body, and if you have too much, it can make you feel even more exhausted and tired than if you'd had none at all.
Absolutely. And
Mhm.
a lot of that has to do with how much you get regularly. Like your body becomes used to, if you only get 5 hours a day, your
Mhm.
body adapts and becomes used to that. So when you
Mm.
actually do get a full 8 hours, you're like, it's too much,
Yeah,
you know?
yeah, it throws it completely, it derails it. It's like, "What just happened?" So the second one, avoid caffeine and alcohol. Caffeine is a stimulant and keeps the body alert and energized, and alcohol can make you more restless. A bedtime ritual. So, rituals such as brushing your teeth, washing your face, send psychological symptoms to alert your body that it's time to sleep.
Mm,
Meditate. So, clear your mind. Meditation can help improve your focus, mindfulness, relieve anxiety, and really reduce stress. I really struggle to meditate, but what I do is my journaling. I clear my mind of all the things, put it in my journal, close the journal, and then try and take it from my head so that I don't start laying there thinking about it all night. Because have you ever laid down and, like, it's true what they say that sometimes a quiet room is actually the loudest. And when you're on your own in your
absolutely.
room, it's really, really difficult sometimes when your mind is just going over and over and over everything.
Yeah, those racing thoughts when you
Mm,
lay down. Um, and speaking of that, Gemma, a lot of folks will tell you that, or sleep experts or whatever you want to listen to, doctors will tell you when you're trying to get proper sleep to not have any distractions, have a dark, empty room, have a dark room without television, electronics, all that shit going on. Um, my personal opinion is that's all well and good. Maybe that's by the book and all, but if your TV being on a low volume or one of those noisemakers that just play like creek sounds or whatever,
mhm.
or rainforest or what have you. If that is enough of a distraction to allow you to achieve REM sleep, then that's what you got to do.
Yeah.
You know, it does you no good to listen to the doctor if you're just sitting there staring at the ceiling fan all night.
Yeah.
Anyway, that's my personal opinion. I'm not a medical well, I ride an ambulance, but I'm not a medical doctor. So always listen to your doctor.
Yes. Everybody's different. So yeah, you take the advice, what's relevant for you. So as Tim's just mentioned again, unplug, limit the use of electronics 1 hour before bed. The light emitted is proven to disrupt your body clock. So such as phones and things give like a blue light, and that can totally mess with your sleep patterns and everything. And then the number of times that I don't know if you don't use your phone for an alarm, it's best to either put it to the other side of the room or in a different room completely, because sometimes the temptation to just think, I'm just going to look at my phone, and then you do that doom scrolling and you're just there, or you can be like, oh, I'm just going to have a quick look at my phone. And then like hours later, you're just doom scrolling, like looking through mindless stuff, and you've been there how long? So if you don't actually need your phone in your room for like an alarm or anything, try and put it to the other side of your room so you can't just easily reach for it, or out of the room completely. I'm terrible for picking my device up at night. I will admit I'm terrible. And then physical activity. So aim for 150 minutes of physical activity a week, or about 30 minutes each day. That also helps to like just keep you fit and things like that, keep you going, keep your body going, and give you like the workout I guess you need to tire you out enough.
Yeah, there's a bunch of other stuff. This is just 6 tips that we found,
Yeah.
and these are really good ones.
Mhm.
Physical activity is definitely one of the most common sense ones, I guess, that
Mhm.
often gets overlooked. Um,
Oh yeah.
you got to do some physical activity to drain your battery. If you go to bed with still a bunch of energy, you're not going to be able to rest.
Oh yeah.
And on that note, a couple things that I saw. One was the noises annoy me, but a purring. Molly says those noises annoy me, but a purring cat works. Excellent. Therapy animals can do just that. Even if it's not a therapy animal, just having a pet, or something close that can not always. We're not always looking at a distraction point of view, but like just assist in helping calm the anxiety, and
Mhm.
what have you. And then Jay Opera, our good friend, also mentioned sleeping pills. Sleeping pills help JK. No, not JK. That is actually a thing. Um,
Yeah.
and a lot of people that are diagnosed with depression, anxiety, and all of that actually get supplemented with a sleep pill, or some kind of um, they get prescribed some sort of medicine to
Yeah.
help.
Like melatonin.
Yeah, melatonin is over the counter here in the United
Not over
States,
here.
but
Oh, okay.
when I was down at rehab, they had me on something called trazodone, which helped me,
Mhm. That's
settle
tough.
down, because I was a lot going on in my life at that point in time, and it was all coming to a head. So,
Mhm.
yeah, I mean, obviously, you want to respect sleeping pills because they can be dangerous, but just like any pill, that you don't want to abuse it. But they they do have them, and they often coincide with depression meds and such, especially anxiety. But moving forward, Gemma, onto the next slide if you'd like. I just wanted to stop and
Yep.
mention that. Also, I did want to say hello to a few people that I missed.
Mhm.
I'm not sure if I officially said hello to Shirley, but hello to Shirley, Molly, and Ray, a ray of sunshine.
Mhm.
He gave us a awesome shout out on his own stream yesterday, was it?
Mhm.
Ray, I'm sure all of you in the chat know who Ray Sunshine is, but if you don't on the replay, please check him out. He puts on very positive streams
Mhm.
and just some good stories. There was actually one on a mental health subject with depression. And yeah, I highly recommend it. So thank you again, Ray. Appreciated that shout out, and good to have you along.
Mhm. Okay, so we'll have a look at this one. No. So common sleep deprivation symptoms. So some of these are like pretty obvious. Fatigue, difficulty concentrating, paranoia, mood changes, memory problems, and hallucinations. So they are like pretty self-explanatory. You can get other ones, especially as it builds up, but then like when it becomes sleep debt, obviously you get a lot more.
So
But that's different.
fatigue, difficulty concentrating, and mood changes are
Mhm.
fairly early on symptoms.
Mhm.
It doesn't take long to start noticing these effects. Memory
Yeah.
problems. I don't know about paranoia, but memory problems and hallucinations, especially if you're hitting this stage,
Mhm.
there's a real problem, and this is getting dangerous too. So definitely,
Mhm.
if this sounds like you, please go to your doctor or maybe the hospital. You need to get
Yeah,
some
definitely.
sleep.
The fatigue, difficulty concentrating, and mood changes can be like after maybe just 1 or 2 nights, but the other ones, memory problems, yeah, a couple of nights maybe. Hallucinations, but certainly paranoia. Definitely, I would go like questionable more sleep debt. I would have said after a long-term problem, but then, as I say, you need to be getting some help with that if that
Yeah.
sounds like you or anyone you know. So let me just come out of these because they're not wanting to show me the slides. Right, okay. So we have now, we've not done this one, have we? No. So how sleep affects your health. So we have impaired impaired cognition. I can't speak. Lack of sleep impairs your memory and your ability to process information and speak, apparently. Higher levels of anxiety. Lack of sleep raises the brain's anticipatory, oh my goodness, reactions, increasing in overall anxiety levels. I wouldn't recommend trying big words when you are sleep deprived. You can't say them. Stroke risk. When you sleep 6 hours or less a night, your chances of a stroke increases by 4 times. Increased risk for diabetes. Lack of sleep increases cortisol. And oh dear me, why did I pick this one? No, I can't even see that. I can't see. No, Nora, you're gonna have to read that one. That's a medical term. I can't read that.
Where are you at?
Bottom, increased risk for diabetes, lack of sleep,
Oh,
increased
norepinephrine.
that. There we go. Both are associated with insulin resistance. There are certain words I need to put my teeth back in for, apparently. Increases symptoms of depression. A lack of sleep disrupts neurotransmitters to the brain, which regulates the mood. Increased risk of breast cancer. Melatonin decreases when you are exposed to light late at night. A decrease in melatonin disrupts estrogen production, which can lead to breast cancer. Increased risk for heart disease. Blood pressure decreases when you sleep. And weight gain. Sleep helps balance hormones that make you feel hungry and full.
So,
Definitely, I remember one night when I was like struggling to sleep.
Mm-hmm.
And you've ever had it where it's silly o'clock if you're not asleep and you feel really hungry and you end up raiding the fridge. I've done that a few times.
Oh yeah, absolutely. That's a
Yeah, I
staple.
find I'm really hungry. Like, I can go the whole day nearly without eating. But then if I'm awake at like 2, 3 in the morning, I really get the munchies.
And it's one of those things that helps some people. Just a
Mm,
simple, you know, quick little snack, put something in your stomach, and gives you that whatever.
a bit of
Uh,
a rush, like a boost.
well,
Right?
it helps calm them down and go to
Mhm.
sleep. But
Yeah.
there is also what you're saying. Um, there's the other side of the coin too. Some people react a different way, and it does give them a bit of a rush. And
Mhm.
now you're not going to sleep. But
Yeah.
it's I find it incredible how many times we see heart disease
Mhm.
on these mental health topics we discuss. There's so many mental health issues, big or small, that just that affect your heart directly, um, because of the constant rise and fall of the blood pressure, the rise and fall of your heart rate, et cetera, et cetera. It's just stressful on that heart. So be mindful of that. Speaking of mindful, actually, I forgot one. I forgot to mention. I'm going to pull this down real quick and go back. Uh,
Mhm.
Number 4 here, meditate. Not everybody knows how to meditate properly. I,
You
for
can't.
one, have no clue how to meditate, and do it to a point where you see some actual um, change.
Mhm.
However, for those like myself, I wanted to throw it out there that there are, and Gemma's done a few on the stream. There are guided meditations on YouTube.
Mhm.
There's a bunch of them on our YouTube channel. If you find the Mental Health Hour on YouTube for our replay broadcast, which is also in the bio link, we have a separate channel on the Mental Health Hour where I put some videos of different things.
Yeah.
And Gemma's found some things, but there's some guided meditations on there as well.
I have some to
And
upload as well for us,
yeah,
so. Mhm.
it's just you are able to turn the lights down, maybe throw on some aromatherapy if that's your thing, and
Mhm.
then listen. I usually use headphones
Mhm.
myself, but listen to a guided meditation and just to try and do everything they say.
Yeah.
You know, feel what they're talking about, and it really does help you relax. So just wanted to throw that. I thought about it when we were on this slide.
Yeah.
Right on.
Uh,
Continue.
think we have just the one left. Yep. So this is the sleep deprivation effects. Lack of sleep is a health issue that deserves your attention and doctors' help. Not getting enough sleep due to insomnia or a sleep disorder, such as obstructive sleep apnea, or simply because you're keeping late hours, can affect your mood, memory, and health in far researching and suppressing ways. And it's just saying about these here now. I'm just going to go through the effects of these. So safety. So there are approximately 6,000 fatal car crashes caused by drowsy and driving each year.
Mhm.
1 in 25 adults who have fallen asleep at the wheel in the past month. Um, Brain effects. So 33% increase in dementia risk. A greater risk for depression, irritability, anxiety, forgetfulness, and fuzzy thinking. 3 to 5 years is how much sleep deprivation can age your brain. 48% increase in developing heart disease. 3 times more likely to catch a cold. Increased risk of high blood pressure.
There it is.
36% increase in risk of colorectal cancer, nearly 3 times risk for type 2 diabetes, less active immunity protectors called natural killer cells, and then your weight, more cravings for sweet, salty, and starchy foods, and the higher levels of hunger hormone. Is that I can't pronounce that one. Ghrelin, is it? In the yellow box.
Sorry, I was looking at the comments. Where
In the yellow box, above 50% higher levels of hunger hormone. Is it ghrelin or something?
hormone, I can't even read it, to be honest with you.
Anyway, the word that's on the screen. I'm sleep deprived as well. Lower levels of the appetite control hormone leptin. And then
yeah, the hormones and stuff. That's chemistry and what have you. I'm not good with that.
They always give them such obscure names.
There
I
are
always try and check when we're looking for slides to make sure I can pronounce everything, but I did not do that this time.
So I took a real shine. I really like talking about the topics and the ins and outs of how the brain processes things like that. But when you start getting into hormones and what have you, that's way above my level of that's starting to get into schooling. So this is something I do just to keep myself educated and to help with my own mental health, because it really does.
Yeah, sorry, I was just replying to something there. But yeah, I've got some helpful.
As you said there, and we just talked about it, the increased risk of high blood pressure, heart disease again. It really is. If you look back through the topics we discussed, and you look at some of the cause and effect or the symptoms, or what the effects could be, long-term effects, heart disease is one of the top ones that we see all the time.
Yep. It's on there for a lot, and it is true with the blood pressure and stuff. I remember when I was going through doing university and things like that, and I was getting by on maybe 2-3 hours sleep a night at best, and I was living on energy drinks and stuff like that. That was not helping, but I ended up having to have blood pressure medication for the first time in my life. I was only in my early 20s at the time, and I was having terrible problems with blood pressure and loads of other problems just because it was down to lack of sleeping. And when I started getting back into a better sleep routine, things started leveling out better and I was able to come off them. So it really does affect your body in so many ways. And it's true that sleep allows your body to recover for so many different things, even when you're like poorly or just every day. Everything needs to have some downtime, some recharge time from electronic devices. You have to plug them in to get the power to work, and that's the same for a person. Like if you're literally on the go all the time, burning the candle at both ends to the point where there's nothing left. And if you're not like giving yourself time to rest and recover, you're just going to burn yourself out completely till there's nothing left. So
100%.
Allow yourself time to recharge, because if you can't, especially if you're like, if you have family or people that are reliant on you as well, if you aren't looking after yourself, how can you look after other people? To be at your best, to look after someone, you need to be at your best too.
Yep.
And it can be hard, and you're going to find that with a new baby, especially because I remember it well. Like I didn't have the help at all. Like technically wasn't on my own at the time, but I was doing all of the work. So I was doing all the days, the nights, and I was absolutely exhausted to the point where I thought if I don't get the sleep, I fell asleep once holding Thomas, and I thought I'm gonna do some serious harm here if I don't start looking after myself.
Mm-hmm.
And it's true that like there's only a certain amount of time you can go where you can just keep on staying awake. And then at some point, your body will be like, nope, that's it. And it's usually at the worst time, like when it said about the car accidents and things like that.
Mm-hmm.
I've actually seen somebody fall asleep at the wheel and they came off at the side of the motorway and crashed, and it took out loads of vehicles. And that was absolutely awful to witness that. And they fell asleep at the wheel. And by doing that, just momentary lapse, just falling asleep, and it caused such devastation to so many people.
Yeah,
And
it's a real thing. And I mean, not just like the traumatic injuries it could cause, like you were just talking about with car accidents and what have you. A lack of sleeping without, or I mean, I'm sorry, going without sleep 4 days at an end will result in death. It is, it's just one of those things that your body needs to live. Sleep is one of the most important things, but also one of the most underrated things. Everybody says, I'll have time to sleep when I'm dead, or there's too much stuff to do to sleep.
Oh, yeah.
And, you know, that's true. But however, on the same token, you're not going to get anything done if you're tired. Once you start racking up enough sleep deprivation and the adrenaline that you're running off of, like I myself are, and I'm sure any firefighter will tell you, we're able to do it because of adrenaline and because it's our job, and that's when the bells hit, we're always ready. But eventually that adrenaline will wear off, and that's when you're going to run into some real issues, like we talked about earlier, the cognitive failure, your sharp mind. You lose that decision making, and then not to mention all the health risks, which it will result in death if untreated. There are some conditions that will, it's not just insomnia. I mean, you cannot sleep. Your body will go into like cat naps or what have you. I don't know much about it. I just know that it exists. But that's an extreme case. So most of us just deal with the everyday busy lives, busy schedules, work, running that household, and you know, just losing sleep while you do it. So looking at my current situation right now, there is time for sleep. Penelope does allow some naps and what have you, so I am getting sleep. I'm not just running on fumes, obviously, or I wouldn't be able to probably do this show. However, it's definitely, I can feel after a week of this, especially being in the hospital those first 3 days, because I didn't get a bed. Now, my wife got a nice bed because she was the patient. Plus, she deserved it. After the 9 months that she went through carrying Penelope, and then major surgery to boot to get her into this world. Yeah, the bed's all hers. But I did get a nice little couch that was like sleeping on plywood. So the sleep,
I know the soul.
there's nothing like getting back home. I do love that. And yeah, there's been some sleepless nights, but during the day I can make up some of that. my wife isn't totally helpless. She can watch Penelope for a little bit while I grab a nap. If there is something that comes up, she can always come get me, or they can wait till I, come back down or whatever. So it's all about taking care of you. As somebody said earlier, who was that? I think it was Shirley. I can't find it right now, but
the comment about falling asleep.
No, it was you're no good to anybody if you're burnout.
Oh,
So,
yeah.
I mean, that's definitely a truth of life. Especially we say that a lot in the fire service. You got to take care of you mentally, physically, emotionally, all that. Because if you're coming to work and you're not 100% healthy in all those aspects, like, you're now putting other people's lives at risk that are calling you for help. So if you're not good, you're not good to take care of anybody else either. There you go. Thank you, Gemma. You're not good to anyone if you burn yourself out. And that's truth.
Oh, yeah.
That's a fact. And that stretches far beyond the fire service. I was just throwing that as an example. But I mean, stay-at-home mom. You got 4 kids. If you're not 100%, what good are you to your children? When it's time to do math homework, and you got 4 kids lined up doing math homework, and you're not yourself, you're not 100%. Are they getting the attention that they need? Especially in these times of COVID, when a lot of that is put on us parents.
Oh, yeah. Your parent and chef and teacher.
Exactly. All of a sudden, our kids are being taught mathematics and chemistry and whatnot from firemen and a bartender. Like, what? I didn't go to school for this shit.
Yeah.
I barely got through myself. So, but and not to mention, they teach the shit all different now. So I'm trying to. I'm good at math. I'm real good at math. So I take care of the math homework here, and I go over it with them, and that's not how they showed us. I'm like, look, this is how I know how to do it, and this is how you're going to learn how to do it if I'm the teacher.
At the end of the day, if the answer's right, then But yeah, okay. I think you might be going to go see the Penelope situation, hopefully.
Yeah, hang on one sec.
Okay. Yeah, no worries. Just like he's really good at just disappearing at like a moment's notice. But yeah, if hopefully we can have an introduction of Penelope. But yeah, one thing that I mentioned in the comments, if anyone's wanting to be on the show, then do let us know. He is terrible at just getting up and flitting off. Like when we're recording and stuff, he'll say he's ready and we'll record, and then he just gets up and I'm like, well, you weren't ready then, okay. The 10-minute maximum recordings can take 2 and 3 hours to record. And it's just like, okay. Oh yeah, he does. He really does. Busy. Hopefully Penelope can come and meet us. But oh yeah, definitely on Ella's broadcast. I don't think he's been on with Ella for a while, has he? I feel like I should show the bunnies. Well, I've got a green screen. I'm trying to work the settings out for doing the recording and stuff. Oh, there we go.
This is Miss Penelope.
Oh,
Penelope Emma Page Conrad. And she is 5 days old. And she's asleep. So I just wanted her to make her live streaming debut and bang the hell out of my knee on my way trying to get out.
We didn't hear anything. Oh,
This is
it
Penelope.
looks so peaceful.
Yeah, I almost didn't bring her up because with all the doctor's appointments and
Bless her, yeah.
going to stuff, she's been going through it today, and she was sleep deprived.
Yes.
But she's making it up now.
Oh yeah, hopefully you'll get a decent night though. Oh, she's just so precious.
Yep.
Bless her.
So I'm gonna take her back down to be with
Yes.
Mama and to get
Yes,
some.
you do that. Do you want me to? Oh, I can't do it. I can't do anything.
What's that?
I was gonna say, do you want me to? No, we can wait for you. Don't worry. I was gonna say, did you want me to like end it or raid somebody? But I can't. I can't do it.
Oh no. Yeah, we'll wrap it up when I get back. I'll be.
Yeah, we wait for you. Go. You go take her back. Oh. Oh well, I'm glad he was able to bring her up. That's for sure. That was a lovely introduction. They look so peaceful when they're like that, and then he's showing babies, and I'm like, I want another one now. But then I think about what I went through with Thomas to get him to bed, and I'm like, no, I don't want one that much. Not another one. Oh dear. He really is. He really is a proud daddy. He it's like when you see how Tim is and things with Penelope, and then with his other stepkids, and it does certainly for me with the stuff that I've been through. Oh yes, Tracy, definitely when you can hand them back. But when I forgot what I was saying now. Oh, my memory's terrible. Sleep deprived.
All right.
Yeah, there we go.
Sorry.
I was just saying that it makes me want another one, seeing Penelope, but then I think about what I went through to get Thomas to bed, and I'm like, no, I don't want one that much.
So she's been great. I mean, granted, she's only 5 days old.
Mm-hmm.
With bedtime, there's no such thing. But I'm sure you remember when being this young, it's eat, sleep, pretty much. So
eat, sleep, poop.
She hasn't been in any trouble, obviously, quite yet. So wait till she's 8 years old and wants a video game all night.
Oh yeah, I can totally tell you all about that.
Right. So
got a whole 18 plus years to catch up on the trouble, so don't worry about that one.
Yeah. I was holding her today, and I was thinking to myself, you're going to be 15 years old before I even know it. And here I am holding you right now. And I just took that in for a moment. That is being mindful.
I had a photo come up in my memories today that was from 8 years ago today. And I'm like looking at it thinking, my gosh, I remember that as if it was yesterday. And they really do grow up in the blink of an eye.
Mm-hmm.
Like, and you can miss it.
All right. Well, let's start wrapping it up so I can get back down to them.
Yes.
She'll be up before long, and then it's back to eat. I think we're on eat at that point, and then probably poop.
Eat, poop, sleep.
Yeah.
Yeah.
So Gemma and I would both like to thank everybody for being here tonight. As always, all the support is fantastic. We do this show. I've seen it several times in the comments now from different people about how this topic or whatever is hitting close to home. And that's what Gemma and I really want to make happen with this show. We want to talk to people that go through this stuff like we do. Obviously, I don't go through every single thing that we talk about, but I've been through enough that I can weigh in, I think, on different things. And Gemma complements the show as well because she's been through a whole separate gamut of stuff. So together, there's all kinds that we can talk about and discuss. And if it gets close to home and you want to discuss further, maybe in private, our DMs are always open, both of us. And the Discord is there for you, and the bio link. But
I've actually just applied to do a course within the mental health field as well. So we'll see how that goes.
And as Hattie reminds us, thank you, Hattie.
Yes. I was getting them, and then you brought Penelope, and I got very distracted.
For all things bunny, please check out Ella the Bunny Mom, www.mybunnyvalentine.com, and use FireDude15 for 15% off of your purchase. Ella hasn't been here she's really busy right now, moving stores. She had her lease was up or something. That's besides the point. She's moving to a different location now and opening a better store, better location, I'm sure, and moving up in the world with the My Bunny Valentine brand. And what that is to help bunny rescues everywhere, as she says, as that's become her life passion. And Ella was nice enough to join us on an episode of the Mental Health Hour for an interview. And we talked about her story. I think it was episode 16. If you catch it on the YouTube channel, she is there. She also streams every night. As I mentioned before, Ray, a Ray of Sunshine, he does the Ray of Sunshine broadcast. I'm not sure on the schedule, Ray. I'll let you throw it in the comments if you'd like. And Ray, subscribe to him. He puts on some very positive streams. And last but not least, Catalyst. We always promote Catalyst here. It's another great, I consider it a mental health stream. Gemma in Chicagoland puts on a great candlelight, soon to be fireside chats, where he just plays a picture or the video of a candle, and you come in and you just talk about whatever. Sometimes there's a topic, other times it's just a free for all. Whatever's on your mind, let's talk about it. Tonight, 11 p.m. Eastern, every Wednesday on Twitch. Catalyst with Gemma in Chicagoland. Sorry, Gemma. What were you going to say? I think I cut you off.
I can't remember now. Don't worry. I'm just demonstrating the sleep-deprived brain and the memory loss there for you.
Awesome.
Don't worry.
Well,
I think I was saying I'd seen a couple of Ray's broadcasts as well.
Yeah.
And very good.
Good stuff. All right, guys.